my name's Pandora Pound, and today I'm going to be talking to you about the harm benefit analysis. So, I work for a UK charity called the Safer Medicines Trust, and that's a patient safety charity that aims to make medicine safer by encouraging a transition to drug development that's based on human biology rather than animal models. I'm going to start with an introduction to the harm benefit analysis, and my focus in this part will be on the UK and Europe. So, the common sense view of animal research is that it's something unpleasant that we don't really want to think about very often, but which we ought to accept because we are told that it achieves benefits for humans. And those benefits that I'm going to be talking about today are mainly drugs. And the ethical context in which this occurs is one in which humans are seen as counting morally more than animals. So that enables us to conduct research that harms animals because we believe that if the outcome benefits humans, then that makes it okay. And that's a utilitarian ethical approach. And that means that the ends, the benefits for humans, are seen to justify the means, which involve harms to animals. So it's worth pointing out that the animals used in research for human treatments won't benefit in any way from the research. And that's just to distinguish it from research on animals that is intended to have relevance for animals. And in animal research, of course, animals don't consent to being research subjects, and their vital interests, such as their freedom, their instinctive behaviour, these are sacrificed for our human interests. Now, this lack of benefit or consent would be considered unacceptable in the context of human research, and I just really wanted to give that context. So the harm benefit analysis, it's conducted as part of the licensing of animal studies and has been done so in the UK since 1986 and in Europe since 2013. It's a key part of regulation. It involves weighing the anticipated benefits of research against the predicted harms to animals. And the aim is to assess whether the harms to animals in terms of their suffering, pain or distress are likely to be justified by the expected outcome of that research, and to consider whether the research may benefit human beings, animals or the environment. But in this talk I'm going to just be focusing on the human benefits. So what are the steps involved in gaining approval for animal research in the UK? Well, you have to come up with your idea for your research project. You then have to get funding for it. If you secure funding, you then submit your project to the Institutional Animal Welfare and Ethical Review Board, which is usually a university ethical review board. And if you get the green light from them, you can apply to the Home Office, which in the UK is the department that regulates animal research, and you'd apply for a project licence. So the Animal Welfare and Ethical Review Board consists of vets, animal care staff, statisticians, hopefully, lay members, and scientists. Now, at each stage of securing funding, getting approval and getting a licence, the researchers will be asked to weigh the harms and benefits of the research and to show how their research complies with the 3 Rs: replacement, reduction, and refinement of the use of animals in research. Now, I'm assuming you all know about the 3 Rs, so I'm not going to focus on them here or explain them, except to point out that under the replacement principle, animal research is only permitted if there's no other animal-free option. If you're looking for funding, and I've just sort of given some of the main funding bodies in the UK here, you'll send your research project to a funder, and when they receive your application, they'll send it out for peer review. So they'll send it out to experts in the field, usually academics. Now, these experts will need to have expertise in at least 3 areas, but unfortunately, just because that's the way of life, they rarely do have this sufficient expertise in all 3 areas. Ideally, they would need to have expertise in the subject matter to know whether the proposed study is necessary and is likely to benefit humans, in the proposed methodology to see whether the experimental design is appropriate and the methods are sufficiently rigorous, and in the availability of non-animal methods, replacements, to know whether the proposed study is necessary or whether it could have been done or could be done without using animals. And this lack of expertise is also found really on the ethical review boards as well. Again, there's a lack of knowledge about the subject methods and non-animal approaches. The expertise on the ethical review boards tends to be in animal welfare. So the benefits of animal research are generally assumed. It's taken for granted that the research will be approved and that the only role of the members of the review board is to minimise the harms to animals. This is also partly because it's easier to assess predicted harms than benefits. Catherine Shupley conducted some research about 10 years ago now, in which she interviewed ethics committee members, and they bore out many of these points. So one of them says here, the benefits of science are totally unpredictable. It can often be 50 years later when we actually benefit, so making decisions about benefits is difficult, and I think it's mostly the cost that we look at. It's also the case that scientists' somewhat optimistic assessments of their research are accepted at face value. So obviously, if you're looking for money or approval for your research, you're going to put a good spin on it. And the point is that this assessment is often accepted without too much scrutiny. And perhaps surprisingly, the harm-benefit analysis, as a formal analysis, a weighing of harms and benefits, is actually just not conducted during these meetings. Not all boards have statisticians as a standing member either. Now that's a problem because if there's not expert commentary on the experimental design or the use of statistics, or just a commentary on how robust that research is, then it's very difficult to know whether that research is going to have useful outcomes, whether it's actually going to be producing robust findings and will therefore be worthwhile. It's also the case that lay members are very frequently drawn from the institution, and so they'll share the institutional goals, one of which will be animal research. So board members do tend to be signed up to the animal research paradigm. As one of Shupley's interviewees said, obviously I completely believe in animal research or I wouldn't be on the committee. Scientists and scientific goals are also found to dominate these proceedings, and this creates a bit of a power imbalance on ethical review boards. It makes it difficult to challenge scientists, for example, about whether the research is likely to be beneficial. John Gluck, who was a professor and an established scientist himself and a user of laboratory animals for many years, became a chair of the Institutional Animal Care and Use Committee in one of the universities in the United States. And he found that many scientists had an exaggerated confidence in the value of their animal models, were able to exploit weaknesses in the system, and actually were quite arrogant. They were resistant to the ethical review process when it was first instigated. They weren't used to being challenged and they were hostile to it. John Gluck wrote his autobiography, which sort of charted his journey from being a primate scientist to actually looking at the ethics of animal research. And he said in this book, I'm quite convinced it was because I openly expressed doubt about the questionable validity of many of the animal models of psychological disorders that my term on the medical campus Institutional Animal Care and Use Committee was not renewed. So if Gluck, who himself was a scientist and who had himself used animals in research, found it hard to stand up to these researchers, one can only imagine how daunting it is for those who have less power on ethical review boards. So, for example, if a lay member asks what are the likely outcomes of the research, and the scientist assures them that it will help find treatment for cancer, for example, or help with a particular children's disease, that lay member is very unlikely to sort of press the issue. So what about the regulators? In the UK, there are about 20 inspectors for the entirety of the UK, and not all of those even work full-time. They're supposed to conduct an independent harm-benefit analysis, but the evidence suggests that they generally accept the harm-benefit analysis the researcher themselves has put forward, which of course is likely to be fairly subjective. The inspectors also tend to focus on the harms rather than the benefits, and that's because their expertise, generally they come from veterinary backgrounds. But really the principal question should be, is the research worth doing in the first place? And only if the answer to that is yes, should they proceed to considering harms. There's also insufficient attention to the quality of research, both on ethical review boards and amongst regulators. Staggeringly, it's the case that every single application for animal research submitted to UK regulators is accepted. Not one of them is turned down. So it seems like the approval process tends to be rather sort of rubber stamping exercise rather than a thorough scrutiny. And it doesn't have to be like this, because in Slovenia, over half of all applications are rejected, while Hungary rejects about a third and Italy about a quarter. I'm just going to look here at a case study which throws some light on how the harm-benefit analysis worked a couple of decades ago now in the UK. So in the 1990s, a company, Immutran, which was a subsidiary of the Swiss company Novartis Pharma, was conducting research to transplant genetically modified pig organs into non-human primates. So the aim was to demonstrate that pig hearts or kidneys could support life in a non-human primate, and if that could be proved, that this would pave the way for human trials. So they justified their application on grounds that there weren't enough human organs available and that animal organs might provide a potential solution. The idea was the organs from pigs would be tried in primates, and then, for example, in the case of kidney disease, it would mean that patients would no longer have to go on dialysis but would be able to have a transplant. And Dan Lyons, in 2003, he was an activist. He won the right to publish some confidential documents describing these experiments, which he argued successfully were in the public interest. And they show how the harm-benefit analysis worked in practice. So the documents showed that the company's assessment of research severity was accepted by the Home Office, even though it didn't take into account the range or intensity of harm suffered by the non-human primates. For example, one of the documents says the Home Office will attempt to get the kidney transplants classified as moderate procedures, even though they involve some fairly serious and severe harms. And these experiments were approved repeatedly by the Home Office, purely on the basis of Immutran's claims that they would be able to overcome organ rejection, even though the documents show that they weren't anywhere near achieving this. And Lyons concluded that the Home Office were acquiescing to the scientists' assessments of harms and benefits, and that there was cooperation between the regulators and scientists, where scientists were actually the dominant party. In one of these documents, it shows the Home Office says that literally it will just be a rubber stamping exercise, referring to an upcoming meeting. This is known as regulatory capture. So this is the idea when a regulatory agency which is created to act in the public interest instead advances the concerns of the sector the agency should be regulating. Now, the Home Office has recently identified that this is a risk and is attempting to address the issue. So, despite reviews in 2003, 2015, and most recently in 2017, it's still very unclear exactly how the harm-benefit analysis is conducted. Now, the public attitudes to animal research, this is a survey that's conducted every 2 years in the UK to look at UK citizens' attitudes to animal research, revealed that the most common characteristic associated with animal research organisations is secrecy. And in this sort of atmosphere, it's not surprising really that undercover investigations are conducted frequently, because people see this as probably one of the only ways of gaining accurate information and a measure of accountability. So just to sum up where we've got to so far, there's insufficient expertise amongst peer reviewers, ethical review boards, and Home Office regulators in the subject matter, the methodology, and the availability of replacements for animal methods, all the expertise that's needed to properly scrutinise applications. We've seen that scientific goals predominate and that the review boards and regulators seem to fulfil an enabling rather than a scrutinising role. We've seen that the emphasis is on harms, with the benefits for humans actually just assumed. So in the next part, I'm going to be looking a bit more closely at human benefit and asking whether the assumption of human benefit is actually reasonable. So does animal research lead to benefits for humans? Well, if you look at some of these advertisements from animal research organisations and lobbying groups, you would certainly think so. But there's never actually been any systematic evaluation of the benefits of animal research for humans, so we have to sort of try and find the evidence in any way we can. One way is to look at how often medical researchers actually draw upon animal studies. in the work that they do to benefit and produce treatments for humans. So, for example, 178 rat studies of clinical depression were cited by other researchers almost 9,000 times. But fewer than 10% of these citations were in medical papers, so they weren't being read by doctors or clinical researchers. They weren't drawing upon the rat findings very frequently. And this cast doubt upon the contribution of rat research to the understanding of clinical depression. There are many such studies like this. For example, this other one, of 95 chimpanzee studies, half were never cited by any other scientists at all, and only 15% of them were cited in a medical paper. Again, raising doubts about the contribution of these chimpanzee studies to human medicine. Just going back to John Gluck, who we met a bit earlier, after spending a couple of decades doing animal research, he was offered the chance to spend some time in a clinical psychology department, actually treating humans. And he wrote, "During the entirety of my extensive fellowship, I never once heard a single reference to an animal study as providing any theoretical or treatment insight. It was clear that they," referring to the clinicians, "did not read or reference the animal literature in their day-to-day clinical teaching or practice, and I had no reason to believe they were atypical. When I brought up the results of animal model studies during supervision, they listened attentively, but then moved on." Another way of looking at human benefit is to see how many so-called breakthroughs actually eventually translate to humans. So this is Jared Bailey. He's science director of the charity Animal Free Research. And he asked, what proportion of animal research breakthroughs reported in the UK national press actually translates into approved interventions for humans? So he searched a media database for all reports of animal-based research in the year 1995, which is 20 years prior to when he started conducting his study. He obviously was thinking that, that would give adequate time for that research to come to fruition. So he identified 27 reports in 1995, reports of breakthroughs of a specific intervention that had claims about promise for humans. But he found that only one of those breakthroughs clearly resulted in human benefit by 2018, which is a very low 4% success rate. That's his paper there. He concluded that media reports of breakthroughs based on animal research are overly speculative and exaggerated. Another way of looking at the human benefits of animal research is to ask how many drugs get approved for market following tests on animals. And you can see here the blue bar, which is the fifth on the right, shows that just under 10% of experimental drugs makes it from phase 1, which is the first trials in humans, to approval. The majority of failures are due to inadequate efficacy and safety. So animal studies aren't the only cause of high failure rates, but they are now widely acknowledged to play a key role in failure due to their poor ability to predict human safety and efficacy. And if we look at this in a bit more detail, there are hundreds of human diseases for which no cures or treatments exist. Just looking at the leading causes of death in the UK, for example, for cardiovascular drugs, there's only a 6.6% drug approval rate. So of 100 drugs tested for cardiovascular conditions, which would have been found to benefit in animals, only 6.6 are approved. For cancer, the rate is 5%, Alzheimer's 0.4%, and stroke 0.1%. For less common diseases, Crohn's disease, for example, has a higher rate of 18%, but traumatic brain injury, not one treatment has been found despite decades of animal research. The same with motor neurone disease. If we just look at one of these in a little bit more detail. So we've been testing treatments on animal models of stroke since just after World War II. But despite these decades of research, we only have one drug available for treating acute stroke, and that's called alteplase. It's a clot buster. But even this drug went straight to human trials following its success with heart attack, so it wasn't directly dependent on animal studies for its development in stroke. The trouble is, even this drug, the only drug we have, only 10 to 12% of stroke patients are eligible for it. And half of those who take it will even go on to die or remain dependent, so it's not a particularly successful drug. And some drugs have been found to succeed in animals, but actually have gone on to increase the risk of death in humans with stroke, such as diaspirin, enlimabab, sulfatel, and terlizad. A further way of looking at the human benefit of animal studies is to compare animal and human studies for the same interventions and look at the extent to which the results agree. And a key study published in 2007 by Pablo Perel and colleagues compared the findings from systematic reviews of animal and human studies for 6 different drugs. So, for example, they found a systematic review of human studies for corticosteroids, and then they conducted a systematic review of the animal studies of corticosteroids after traumatic brain injury. And they looked at the extent of agreement. They found that the animal and human study findings agreed for 3 of the drugs and disagreed for 3, which they concluded was really no better than a coin toss. So we can see that there's doubts about the contribution of animal research to human medicine. There's still huge unmet need despite decades of animal research. Indeed, most human diseases lack cures. And we've seen that most animal research that's aimed at developing drugs for human diseases fails. Yet unbelievably, the default position of ethical review boards and regulators when they conduct the harm-benefit analysis is an assumption of benefit. So I'm just going to talk here about a study that I conducted. I wondered, would it be possible to look at animal studies that have already been done, so to assess the harms that they actually involved and determine whether they actually led to benefits for humans? This is because, for regulatory purposes, the harm-benefit analysis is prospective. It's guesswork, really. They're conducted before animal studies, so they say, well, are they likely to cause harms and are they likely to produce benefits? But I wondered, could we look at studies that have already been done and do a retrospective analysis? And I thought that this would show whether the harm-benefit analysis was actually working in practice. So does it weed out studies that harm animals without benefiting humans? So this is Alaska, and this is a neurosurgeon, Marius Maxwell, and he funded me to do a little bit of research with my colleague at the time, Christine Nicol, when we were both at the University of Bristol. And it's difficult to conduct a retrospective harm-benefit analysis because you need existing data on benefit. And I've shown that that doesn't exist except in quite disparate sources. So what we did was we went back to the study that I mentioned just earlier, conducted by Pablo Perel, this coin toss study, which gave an indication of the human relevance of animal studies, insofar as if we take from it that where the studies agreed, the animal and human studies agreed, that was an indication of the relevance of animal studies for humans. And we thought that if we had that indication of benefit, and then we went on to collect data on harms that were suffered by the animals in those exact same studies, we'd be able to compare them and we'd have data that would enable a retrospective harm-benefit analysis. So, as we saw, this study group identified published systematic reviews of human studies for 6 drugs and then conducted systematic reviews of animal studies for the same 6 drugs. And these were antifibrinolytics, biphosphonates, corticosteroids, terlizad, antenatal corticosteroids, and thrombolysis. So I'm going to go through each of these. So the systematic reviews of human studies found that the antifibrinolytics benefited humans with uncontrolled bleeding, but the animal studies were inconclusive. Biphosphonates were found to benefit humans with osteoporosis, and they also benefited animals with osteoporosis. Corticosteroids increased mortality in humans with traumatic brain injury, but they benefited animals with traumatic brain injury. Trilizad increased mortality in humans with stroke, but benefited animals with stroke. Antenatal corticosteroids benefited human newborns with breathing difficulties and also animal newborns with breathing difficulties. And thrombolysis benefits humans with stroke and also animals with stroke. So we've got agreement and disagreement, 3 of each. And as I said, this provides a crude indicator of human benefit. Another way of looking at human benefit to add to this is to see whether that drug is actually in clinical use. So that's the human benefit side, the indicators of human benefit. To look at harms, we searched for all the animal studies that Perel et al. Had reviewed, and we extracted data that were described in the methods of those published papers. And we then got an expert panel from the School of Veterinary Sciences at the University of Bristol to categorise the overall impact of these procedures for each intervention. And they used the EU severity classification, so mild, moderate or severe harms. At the same time, we also noted how often the animal studies were cited to calculate citation scores, which would give an indication of how widely used those studies were. And here are some of the examples of harms that we extracted from the publications. So, for example, for thrombolytic drugs for stroke, some of the animals had the stroke induced whilst they were conscious and restrained. The corticosteroids, some animals had no anaesthesia or only light anaesthesia prior to being restrained and have traumatic brain injury inflicted on them with various different methods. Some of them were just left to die. For antenatal corticosteroids, none of the newborns or fetuses were given anaesthesia during experiments. Some were just left to die, and others suffered harms as a result of mistakes in procedures, experiments going wrong. Trilizad for stroke, many animals underwent repeated assessments after having a stroke induced, and some died as well in these experiments as a result of mistakes and things going wrong. So those are just some of the examples of harms that were actually reported, so you can imagine that many weren't. So just looking about how we brought together these indicators of benefit to humans, those are the columns in the middle, harms to animals, the column at the end, and also research importance, which we got from the citation score, and also an assessment of quality. So if we just look at the second column from the left, so animal study quality, Pablo Perel and his colleagues actually assessed every single one of the animal studies, and there were about 226 as having been conducted using poor methodology, so not rigorously conducted. The citation scores that we collected, you can see that they go from low with antifibrinolytics at the top to the highest for biphosphonates. And these citation scores, so these indicators of the research importance, do seem to track a little this agreement between animal and human studies, which is the next column along. So where there's disagreement, where we would argue that the animal studies weren't relevant to the human studies, those citation scores tend to be lower as well. But where the animal and human studies do agree, the citation scores are higher. And you can see from the next column along on the right, so the second column from the right, the treatment in use with humans, you can see that for the final 3, antenatal corticosteroids, thrombolysis and biphosphonates, those were all in clinical use, providing another indication of relevance. However, the harms to animals, the final column, these are generally severe, mostly severe, moderate to severe for all the interventions, apart from the antifibrinolytics at the top, which was mostly moderate or mild. So how do we put all these together to try and come up with a harm-benefit analysis? There's no agreed way of doing a harm-benefit analysis. There have been a few suggestions, but we decided to choose this one, and it's a method called Bateson's Cube, named after Bateson, who developed it a long time ago now. And it's a sort of 3D way of weighing up these harms and benefits. We had the data to populate each of these axes, so harms to animals, benefit, and importance of research. And the idea is if the three assessments fall into the solid part of the cube, the study is unacceptable. Before we go through it, I just have to say that the antifibrinolytics, the animal data were inconclusive, so we weren't able to do a weighting for that. But for corticosteroids and Trilizad, the animal suffering was high, there was no benefit to humans, the research importance was low. So it fell into the solid part of the cube and was unacceptable. The thrombolysis, the animal suffering was high, there was medium benefit for humans and medium research importance, but it still falls into the solid part of the cube. The antenatal corticosteroids, the animal suffering was mostly moderate to high, the human benefits were high, but the research importance was low. So again, it fell into the solid part of the cube. The biphosphonates, the animal suffering was mostly moderate, the human benefits were high, and the research importance was medium. So some of the biphosphonate studies fell into the solid part, but some fell into the clear part and were acceptable. But these formed only 7% of all the animal studies. So according to our retrospective harm-benefit analysis, only the moderate biphosphonate studies were permissible. So only 7% of all the animal studies conducted should have been approved. So we concluded that the regulatory systems in place when these studies were conducted had failed to safeguard animals from severe suffering or to ensure that only beneficial, scientifically rigorous research was conducted. Some concluding thoughts. Current regulations, I would argue, fail to prevent the launch of studies that lack benefit for humans, and that means that animals are harmed, frequently severely as we've seen, with no moral justification. Dr. Emily Trunnell, who used to do animal research and now works for an animal protection organisation, concluded, well, she said, I mean, really, when I got a chance to look at the big picture, the rules mean practically nothing. You can do anything you want to an animal, as long as you write even the most sort of specious justification for it. We've seen that reviews of the harm-benefit analysis process in the UK haven't improved matters. And so I wondered it would be interesting to look at the response from bioethicists, those experts who study the moral elements of healthcare, science and technology. Well, some bioethicists argue that benefits to humans must be a condition of any morally responsible animal research. So we shouldn't be conducting animal research if we can't prove that there's benefits to humans resulting from it. Others, however, propose something, more opposite. They propose relaxing the licensing and approval of animal research, arguing that it can only be expected to produce knowledge, not benefits. There's actually been a lack of ethical input into animal research regulations, whereas human research regulations are guided by foundational ethical principles, for example, the Belmont Report in the US and the Declaration of Helsinki in Europe. Animal research benefits from no such underlying ethical principles. In fact, they were developed by the research community. There was no input from ethicists. And this means that scientific interest is at the heart of laboratory animal research regulation, with the key assumption that animal research is necessary. In 2015, the Oxford Centre for Animal Ethics published an important report, and they concluded that regulations don't protect animals. They said there was an overconfidence in animal experiments as a scientific technique. And they wrote, we cannot avoid the conclusion that animal experimentation represents the institutionalization of a pre-ethical view of animals. So I would conclude by saying that current regulations are unfit for purpose. EU regulations continue to approve studies without seriously considering whether they'll benefit humans and ignoring evidence that strongly suggests they will not benefit humans. So the regulations need tightening, but ultimately we need to move away from animal research and embrace technologies that benefit humans without using animals. This is just a picture of one of those technologies. This is an organ on a chip. So this is a microscopic technology which can be lined with human cells. and it can be used to test drugs and investigate disease. So it's entirely animal-free. And I'm just going to finish with some thoughts of Michael Balls, who's a retired professor of medical cell biology at the University of Nottingham in the UK. He said, "We need to realise that animal welfare is not the only issue. We're really talking about a human welfare issue. If the drugs don't work, then human patients who need treatment aren't getting it, and huge resources are wasted. We should reduce animal use because the results aren't really worthwhile, and increase investment in what we can do with humans instead." Thank you.